So welcome, everyone. I am the Interim Assistant University Dean for Research, Effie McLaughlin. I've been working in the Central Office of Research for about 10 years now, and I um, develop and administer all of the internal grant programs, the seed grant programs for faculty, a number of undergraduate research programs, and also our research development efforts, grant writing and research development efforts, of which this is one of them. Please join me in welcoming Michelle Keeley today. Many of you may have, this is a three-part webinar series. And many of you might have participated last week, so I'm not gonna give a huge introduction of Michelle, but she is the Associate Dean for Research at the CUNY School of Public Health, and she's been there since 2014. She's also professor of epidemiology and biostatistics, and she has an extensive background in a number of federal agencies and sort of public sector type public health agencies. So she was at the NIH, the Office of the Surgeon General. She worked at New York State. She was also at HRSA, the Health Resources and Service Administration. So she has a great deal of experience in programming and grant writing for federal agencies. So she is a great resource for you to present on this topic. So please join me in welcoming Michelle. And Michelle, if you could please take it away.
Okay, everybody, I'm going to stop my video so we'll focus on the slides. So today we're going to talk, this is part 2 on how to improve your grant writing. Come on. It's not going down. All right, so I decided that since last time we had a discussion about becoming an NIH grant reviewer, I thought I'd throw that in before we get to grant writing. So if you're qualified, being a grant reviewer for NIH is a really useful thing to do. And so they have this program called Early Career Reviewer. And what it requires is 1 year of academic experience, being an assistant professor, associate professors. Even if you start out as an associate, you're not allowed. You must have 1 senior authored publication in the last year, plus 1 other senior authored publication since getting your doctorate. You haven't been a PI on an RO1, but you must have previously submitted a proposal to NIH and received a summary statement. And that link at the bottom is the link to find out if you qualify and how to apply. So today we're going to talk about the research strategy. And just as a reminder that in the handouts, there are worksheets for approach, innovation, and significance. It's important to remember the good, the bad, and the ugly parts of grant writing. This is part of having a real sense of perspective about the activity. So the good is grant writing garners funds. It permits you to conduct relevant research, and it will help your career. It also brings your school indirect costs. The bad is that grant writing is hard. It requires repetition and it requires practice. And the ugly is that grant writing is very competitive. And sometimes even the best written grant by the best grant writer doesn't get funded. So you have to kind of do that deep dive. And yes, you are swimming with the sharks. So this slide comes from NIH. As I mentioned in the first session, you have to allow enough time. I didn't actually hear the presentation that this slide came from, but I would guess that it was for an RO1, given that it has a 9-month lead time. But regardless of the mechanism, you really need to devote sufficient time to this endeavor if you want to be successful. These items are general but important pieces of advice. Make sure you use the right set of instructions. Instructions can vary by mechanism or IC or any other number of variables. And it's important to make sure you use the right one. Remember that all winning proposals look different. As you'll hear, it's very useful to look at funded proposals, but Funded proposals look different, which leads to you have to make the proposal yours. Read the instructions. This is crucial. Even if you have the right set of instructions, if you don't bother to read them, which I will tell you many people don't, it isn't helpful. Again, you will notice there's a lot of overlap between the instructions and the scoring criteria. If you write to the instructions, by definition, you should score well, or certainly at least better than if you don't bother to follow the instructions. So your primary task is to turn your reviewer into your advocate. And you do this by making their job easy. Convince them that your work is very important and that you know what you are doing and you can conduct the research you propose. Remember the reviewers for whom you are writing. They could be an expert, someone who knows as much or more about the topic as you do, the sophisticated non-expert, the skilled scientist who knows almost nothing about your specific topic, a technical expertise, a non-scientist who may still have a lot of input into review decisions and outcomes. Think about the strengths and weaknesses of what you are proposing. Why is the proposal important? Why does the work matter? If it doesn't, you probably need to rethink your plan. Why does the work need to be done now? Why are team members necessary and trustworthy? How can you assure the reviewers that the plan is feasible? So first, we're going to look at application instructions for significance. Pay attention because the next slide is the scoring criteria, and you'll see how closely they track each other. Explain the importance of the problem or critical barrier to progress that the proposed project addresses. Describe the strengths and weaknesses in the rigor of the prior research, both published and unpublished, that serves as the key support for the proposed project. Explain how the proposed project will improve scientific knowledge, technical capability, and/or clinical practice in one or more broad fields. So here are the scoring criteria. Does the project address an important problem or critical barrier to progress in the field? Is there a strong scientific premise for the project? If the aims of the project are achieved, how will scientific knowledge, technical capability, and/or clinical practice be improved? How will successful completion of the aims change the concepts, methods, technologies, treatment services, or preventive interventions in the field? We'll talk about the 3 areas to focus on in writing the significance section. These come from the instructions and the scoring criteria. So they are the importance of the problem, the rigor of prior research, and improvement of scientific knowledge. In writing about the importance of the problem, remember that the application's instructions, which tell you to explain the importance of the problem or critical barrier to progress that the proposed project addresses. Remember, we talked about the rhetorical tool to frame your problem. Revisit the problem gap hook solution, but with more detail and different language. In the handouts, there are templates for both a 12-page and 6-page research strategy. This overview should be about 1 page in the 12-page research proposal, or about a half a page in the 6-page research proposal. Revisit your long-term goal, overall objective, central hypothesis, and specific aims in a single paragraph, your solution. Dive into the specific problem as soon as possible. Don't waste space explaining background unless it's relevant to your research project. The piece of advice: the only place you want to repeat information is when you reintroduce your specific aims. They should be written exactly the same way every time. You want them the same way every time because this is the heart of your proposal. So in the significance, the rigor of prior research, the instructions read, describe the strengths and weaknesses in the rigor of prior research, both published and unpublished, that serves as the key support for the proposed project. Use synthesizing the literature and your preliminary data to establish a strong scientific premise for your project. Carefully evaluate the strengths and weaknesses of prior research. You need to step carefully here because the reviewer who's looking at this may have produced some of the literature you're criticizing, or at least buys into the premises. This is a limited review to build a case for your project, not an in-depth literature review. 2 additional review criteria in the portion of the significance section address rigor. Is the prior research that serves as the key support for the proposed project rigorous? And have investigators included plans to address weaknesses in the rigor of prior research that serves as the key support for the proposed project? In the handouts is the link to enhancing reproducibility in NIH applications. This resource chart is in there's a link to that. And for brevity, I have not reproduced all of it because you wouldn't be able to see it on the slide. It reviews 4 areas of focus: rigor of prior research, scientific rigor, design, biological variables, and authentication. At the NIH website, it tells you what each focus area means and where in the application it should be included. This table is only used as a guide. As I have said before, winning grants all look different. Similarly, there are lots of different ways to structure a strong significance section. As I mentioned last time, in the handouts, there's a page with useful links. One of them is from NIAID, which maintains a library of funded proposals. And you can use this link to see sample applications. And they're all the ones that are posted on their website were successful. So some proposals are hypothesis driven and some are not. How you write the rigor section depends on whether your study is hypothesis driven or not. For proposals that are, my recommendation is to write the rigor section aim by aim. In the importance section, you provided context and justification for your central hypotheses, the big scientific picture premise. In the rigor section, provide justification for how you arrived at each aim and its working hypotheses by describing key preliminary data and evidence in the literature. What you are doing is building a case for each aim separately. For hypotheses that aren't hypothesis driven, don't write the rigor section aim by aim. While remembering to be diplomatic, build a case for your project by providing a critique of the evidence in the literature. Think about it as what we know and can critique it in terms of what we still don't know. Remember, you are providing a theoretical framework to justify your approach. So advice, although in theory, all reviewers read all grants, you don't want to count on that. Use the rigor section as an opportunity to help your reviewers who only skim. And that's likely to be, hopefully your primary reviewers will read the whole thing, but since everybody is supposed to read all the proposals, assume that those who aren't the primary ones are skimming. When you're writing, think of the first sentence of the paragraph as a declaration of the current evidence, preliminary data, or from literature, and fill in the rest of the paragraph with supporting information. So RO3s and R21s do not require preliminary data. If you do have it to support your application, limit it to less than 1 page. If you have a lot of preliminary data, it might indicate that you are beyond an RO3 or an R21 mechanism. And one of my faculty who is a reviewer said that NIH is a little loath to give people RO1s before they've had smaller grants, even though technically that's sort of an unspoken rule. So the application instructions for significance. Explain how the proposed project will improve scientific knowledge, technical capability, and/or clinical practice in one or more broad fields. What are the outcomes and what will success look like? What is the significance of that or those outcomes in terms of scientific knowledge, technical capability, and/or clinical practice? What change are you promising? How does your project impact the mission of the IC? Sometimes the FOA has an explicit mission that it wants to accomplish. Advice: make sure that you keep your expected outcomes close to the projects. Think about it in terms of the product of your work. What do you get when you're finished? It's fine to project into the future, but first you must tell reviewers what successful likes. Think about it in terms of this specific work. So the application instructions for the innovation section. Explain how the application challenges and seeks to shift current research or clinical practice paradigms. Describe any novel theoretical concepts, approaches, or methodologies, instrumentation, or interventions to be developed or used, and any advantage over existing methodologies, instrumentation, or interventions. Explain any refinements, improvements, or new applications of theoretical concepts, approaches, or methodologies, instrumentation, or interventions. Now let's look at the scoring criteria. Does the application challenge and seek to shift current research or clinical practice paradigms by utilizing novel theoretical concepts, approaches, or methodologies, instrumentation, or interventions? Are the concepts, approaches, or methodologies, instrumentation, or interventions novel to one field of research or novel in a broad sense? Is a refinement, improvement, or new application of theoretical concepts, approaches, or methodologies, instrumentation, or interventions proposed? Notice again how closely the scoring criteria track the application instructions. The instructions in the scoring criteria suggest that you need to describe 3 aspects of innovation: challenging existing paradigms, novel to your field or novel in general, refinement, improvement, or new application. Before we get to those three aspects, a piece of advice: be careful when challenging existing paradigms. This is especially true if you're a new investigator. What you don't want to do is challenge the worldview of your reviewer. A more pragmatic approach is to show an incremental advancement, a refinement, or a new application. Focus more on the second and third criteria. One of the most important parts of the innovation section is to establish what's current, conventional, or standard, so you can explain how your project brings something new. Make sure you provide context for reviewers to help them see the status quo. In thinking about novel concepts, what is or are the existing concepts, approaches, methodologies, instrumentation in your field that are relevant to your project? What evidence do you have that the status quo is inadequate, keeping in mind that you may be writing to reviewers who disagree? What is the advantage of your approach over existing concepts, methodologies, instrumentation? It's crucial that you take a diplomatic and conciliatory approach to describing the current state of your field. Remember, you may have reviewers on the panel or who disagree or whose work is based on the status quo. Be careful. Let me repeat, be careful. Refinement or improvement is a safer way to go. What is new or unique about your project? How is a refinement or improvement? Explain how or why. Consider going back to the first question, but looking at it a different way. Don't repeat yourself, but keeping in mind the issues as you are developing the refinement. More advice: if there is a weakness in innovation, don't ignore it. If you have a strong case that your not so innovative foundational research needs to be done, justify why it is to be done despite not being particularly unique. If you don't have a strong justification, it may be time to go back to the drawing board. You need to justify why the work needs to be done. The approach section has lots of instructions. Describe the overall strategy, methodology, and analysis to be used to accomplish the specific aims of the project. Describe plans to address weaknesses in the rigor of the prior research that serves as the key support for the proposed project. Describe the experimental design and methods proposed and how they will achieve robust and unbiased results. Note that the links for both enhancing reproducibility through rigor and transparency and the research methods resources webpage are in your handouts. Unless addressed separately in the resource sharing plan, include how data will be collected, analyzed, and interpreted, as well as any resource sharing plans as appropriate. Resources and tools for rigorous experimental design can be found at the Enhancing Reproducibility through Rigor and Transparency website. For trials that randomize groups or deliver interventions to groups, describe how your methods for analysis and sample size are appropriate for your plans for participant assignment and intervention delivery. These methods can include a group or cluster randomized delivery. These methods can include a group or cluster randomized trial or an individually randomized group treatment trial. Additional information is available at the Research Methods Resource webpage. Discuss potential problems, alternative strategies, and benchmarks for success anticipated to achieve the aims. If the project is in the early stages of development, like for an RO3 or R21, describe any strategy to establish feasibility and address the management of any high-risk aspects of the proposed work. Explain how any relevant biological variables, such as sex, are factored into research designs and analysis for studies in vertebrate animals and humans. For example, strong justification from the scientific literature, preliminary data, or other relevant considerations must be provided for applications proposing to study only one sex. Refer to the NIH guide notice on sex as a biological variable in NIH-funded research for additional information. So for example, if you're studying pregnant women, there's an obvious reason why you wouldn't study men, but if it's something like heart disease, there's no reason why you wouldn't be studying both men and women. And really this comes from a history of everybody doing research on white men and then thinking they can generalize it to everyone. There are two more instructions that I didn't include here. Hazardous materials and embryonic stem cells. If you're using either of those, look at the NIH research guidance. Because there's so many instructions for the approach section, make sure you go through them and choose everything that is relevant to your project. As applicable, also include the following information as part of the research strategy, keeping within the application instructions. For new applications, include information on preliminary studies. Discuss the PI's preliminary studies, data, and or experience pertinent to the application. Preliminary data are an essential part of a research application, grant application, and help to establish the likelihood of success of the proposed project. Early stage investigators should include preliminary data. Exploratory or developmental grants, R21s or R23s, small research grants, RO3s, research enhancement award program, REAP grants, R15s, do not require preliminary data. But again, if you have any, I would include it. Even if not required for small grants, early stage investigators should include preliminary data if they have any. In the significance section, you are making the case for your preliminary hypothesis. In the approach section, it is more to show technical feasibility or that the project is in good hands. Although there are fewer scoring criteria than instructions, they still track. Are the overall strategy, methodology, and analysis well-reasoned and appropriate to accomplish the specific aims of the project? Are the potential problems, alternative strategies, and the benchmarks for success presented? If the project is in the early stages of development, will the strategy establish feasibility, and will particularly risky aspects be managed? If the project involves human subjects and/or NIH-defined clinical research, are the plans to address the protection of human subjects from research risks and the inclusion or exclusion of individuals on the basis of sex, gender, race, ethnicity, as well as inclusion or exclusion of children justified in terms of the scientific goals and research strategy proposed? Focus on that justified in terms of scientific goals and research strategy. The instructions and scoring criteria suggest you need to describe 3 aspects: overall strategy, methodology, and analyses, rigor and reproducibility, pitfalls, alternative strategies, and benchmarks for success. Before we talk about structuring the approach, realize that you can't possibly cover every aspect of your approach in the space available, especially for grants with a 6-page limit. You'll need to be selective about what you include, but remember that there are other sections that you can use to flesh out aspects of your approach. More advice: you want to focus on the big picture, overall strategy, methodology, and analyses, and include the pertinent details, experimental design and methods, data collection, analysis, and interpretation, sample size, potential problems, alternative strategies, and benchmarks for success. There are 2 options for structuring your approach section. The first is general information followed by aims. This is a good option for projects that have an overall global strategy and methodology and set of analyses. And the second option is aim by aim, where you would have a very brief introduction to the approach, focusing on the overall strategy to test the central hypothesis. So for option 1, the general information followed by aims. So this option is for projects that have an overall global strategy and methodology and set of analyses. So you would have an introduction to the overall strategy, methodology, and analysis with a justification for how it will test the central hypothesis or achieve the overall objective of the study. If applicable to all aims, sample size justification, data collection, analysis, interpretation of preliminary studies that help justify feasibility, pitfalls, and mitigation strategies. Remember to reiterate your general expected outcomes. For each aim, describe the experimental design and methods and justification of A, how it tests the working hypothesis or achieves the aim. B, it will achieve robust and unbiased results. If not previously described, the sample size justification, data collection, analysis, interpretation of preliminary studies that help justify feasibility, pitfalls and mitigation strategies, expected outcomes of the aim, and benchmarks for success. If you're going for an aim by aim approach, the introduction, remember this is a very brief introduction to the approach, focusing on the overall strategy to test the central hypothesis. Aim 1, description, introduction to the overall strategy for the aim, methodology, and analysis with a justification of how they'll achieve robust and unbiased results. sample size justification, data collection, analysis, interpretation of preliminary studies that help justify feasibility, pitfall and mitigation strategies, expected outcomes of the aim and benchmarks for success. And you would repeat that for each additional aim. So both approaches need a timeline and milestones and anticipated impact. So just as a reminder, option 1 is better for projects that have the same strategy, methodology, and analysis for all aims. And option 2 is better for projects that have different strategies, experimental design for each aim, usually for hypothesis-driven projects. For each aim, you will tell the reviewers what you will do, how you will do it, that you will know how to rectify problems that may happen, and what expected outcomes are and why they matter. How will you know if you are successful? It's crucial that you convey that your approach is feasible and that it's feasible in your team's hands. Use your team's published papers, preliminary data, and any other means you can to convey that your team has the experience and capability to execute the project. You want to include a timeline and milestones. This provides a visual guide to your project's anticipated progress. It's an opportunity to list milestones and expected outcomes. You can use this section to reiterate your specific aims and another chance to demonstrate feasibility and that you've thought of everything. You are now at the part of the approach section that deals with research impact and future directions. Always end on a high note. You want your reviewers to believe in you. This is about your anticipated impact of your project. Assuming that it is successful, which you should, you want to project confidence. Summarize and reiterate your expected outcomes for your project as a whole. It isn't necessary here to do it aim by aim. Remind reviewers of the long-term problem you're trying to solve and how this project helps you get there. The feedback you got on your specific aims page should reassure you that your proposal had just the right amount of ambition. Remember that your specific aims page is the most important part of your grant proposal. As you write the approach section, reevaluate and make sure that you can truly accomplish what you proposed during the term of the grant. Remember, it is feasible. And we'll talk more about this next week, but as you're writing the approach section, keep track of your equipment, personnel, and other items you need to successfully complete your aims. Thank you. Let me start video.
Great. Thank you so much, Michelle. That was
sorry, go ahead.
No, that was great, walking through all the different sections and the advice about how to prepare the proposal. Does anyone have any questions? You can throw them in the chat, or, we're probably a small enough group that if anyone wants to unmute and ask Michelle a question, we could do that. If anyone's working on current NIH proposals or have any questions about the review process. We did mention also last week, I don't know, maybe some of you were in today's session that weren't in last week's section. There is a service provided by the Research Foundation's Office of Pre-Award Support where they have a peer review process. So if you can get your proposal to them a month in advance, they often have external reviewers review your grant, and they have at least 2, and they get back very good feedback on your proposal.
Let me just jump in and say that my faculty that have used their proposal review, they've thought it was really, really worthwhile. And let me just also point out that if you submit to NIH without doing that, you're going to wait 9 months for your feedback, whereas this takes a month. And I was telling a friend of mine who's at a different university, nowhere close by, about this program, and she said, "Oh my gosh, that's like a secret weapon." So do seriously think about using them. It's well worthwhile.
Great. Well, I'm not seeing any questions in the chat. Maybe just, Michelle, could you just give sort of an overview of what you covered last week, how it's tied to this week, and then what we're going to cover next week in terms of the grant writing process?
Sure. So what I talked about last week, there was a lot, and they will be posted. So if you weren't on last week, you'll be able to go back and look at it. I talked a lot about NIH and how almost everything that I've talked about, comes from the NIH website. It's really useful to know where to look for things. I talked about how you can find project officers. You do that with NIH Reporter, which is it's always useful to remember to like talk to a potential project officer because they do work for you. I talked a lot about how the specific aims page is the most important part of your proposal. My suggestion is that you have people who know the field review it because they have a more nuanced view. And I'll talk about this next week too, where I talk about all the bits and pieces that sort of make up, which are really important. I mean, I think every part of a proposal is an opportunity to increase the likelihood of getting funded. But when you do have your specific aim page, I think you should have people who know the field review it. But when you have your whole proposal, I think anybody who's smart, a scientist, should be able to understand what you are doing. Even if they don't understand the deep down technical part, they should be able to understand how you got from A to B. So I remember reviewing somebody's proposal and it was a field that I knew. And I said, I don't understand how you're getting from what you're proposing to what you're claiming is your outcome. And her response was, oh, that's a problem, which yes, it is. I mean, because if I'm in the field and I don't understand how she's going to get there, how is somebody who's not necessarily directly in the field do that? And to Mark, yes, do reach out to your project officer. And if you go back, you can find project officers on the NIH Reporter page. You can write once you have a good version of your specific aims, you can put those into the Reporter link in it, and it'll help you find project officers. It's very specific in the first session.
Oh, actually, Michelle, we have a question here about needing a mentor. Some of the grants, such as SURE, FIRST, or SCORE2, proposals require a mentor. Is it required to have an NIH-funded mentor, or is it okay to have an NSF or USDA-funded mentor? What do you know about mentors?
Honestly, it probably depends on the field and what you're proposing to do. I mean, a federally funded mentor is probably a good plan, but does it have to be NIH? It kind of, if you're applying to NIH, it's probably better if it's NIH, but better to have, but if someone only has funding from NSF, I think that's probably all right.
So the Mark actually asked the question about, do you have any specific advice in terms of when approaching the, you identify a good program officer, you think, so you go to the reporter and you identify who you think is a good officer. Is it a good idea to send them your specific aims, or maybe just, have a phone call, or what is sort of your specific advice in terms of the initial approach?
Well, I would probably put my specific aims in use email. I mean, because who knows who's in their office these days, but even generally, they're very busy people. You could say, these are my specific aims. I'd like to have a conversation with you if you would be, to discuss whether you would be interested in funding this. For people who don't know, NIH has two sides, both intramural and extramural. Everyone you're going to be dealing with in terms of funding is extramural. What they do is they fund other people to do research, whereas intramural part of NIH, they do their own research. So would they be interested in funding it? And when you talk to them, if they say no, you can say, is there anything I could change that would make you interested in funding this? And if they say no, you say, do you know anyone else who would be interested in funding it? So the way extramural officers sort of do research is they have an idea on what they're interested in and they write a funding opportunity. So, and everybody has slightly different ideas about what they're interested in. So even if somebody isn't really interested in what you're doing, they might know someone else who is. You're welcome.
Well, I don't see any other questions in the chat. If anyone else has any other questions, and next, I'm sorry, you might have already cut this, but next week the conversation. Go ahead.
What we're talking about next week is, I call it bits and pieces, because it's bio sketches, it's budgets, it's, I haven't even thought about it in a while. It's all the other little parts that go, you know, how to write your abstract, how to create a compelling title, all of those little bits and pieces that make your grant strong, your grant proposal stronger.
Yeah. And I also mentioned this last week. So I apologize if I'm repeating yourself, but I definitely encourage all of you to also speak with your Office of Sponsored Research and or your grants officers on your campus, because they can also provide, I mean, not only invaluable, advice and information about the bits and pieces and particular stuff like the budgeting, but they also will know funded faculty on your campus and potentially even across the university. So particularly if you're looking for mentors or people that you can just speak to about the process or about your particular research, they have that sort of deep knowledge. So I encourage you to reach out to them. We actually have not uploaded I'm actually going to do that today. We have to figure out where we're going to upload the webinar from last week and this week, but we will do that as soon as we can. And we will definitely send out the links to all the people who registered for the webinar. So if you registered, you will get it.
The other thing that I was going to follow up on what Effie said about your grants officers is one of the things they do is make sure that what your budget does is match the science you're proposing. So that's a really, that's a very useful piece of guidance that they provide for you.
All right. Well, thank you so much, Michelle. And if there's no other questions, we will definitely send you out the email with the links to the last week's and this week's webinars, and please join us next week for the final in our series. And I forget the title of it. Oh, Bits and Pieces. Yes. Wrapping up all the bits and pieces. Great. I'll see you all next week. Have a wonderful summer. Try to enjoy your summer.
Summer?
Yeah, we have a lot of programs going on too. We'll see you all soon.
All right.
Thank you.
Have a good week, everyone.
Thank
you. You want to stay on for a bit, or do you want me to give you a call?
Yeah, give me a call.
Okay.
I'll see you
Bye,
all.
Michelle. Bye, everyone. Take care.
Bye.